On Wednesday, January 25th, Cook County Board President Tony Preckwinkle, along with Commissioner Larry Suffredin, attended an Access to Care site visit at the Loyola Center for Health in Maywood, Illinois.
We are so very pleased that you took the time out of your schedule to come and hear from us today.
With a growing concern increasing throughout the county regarding the repeal of the Affordable Care Act, better known as Obamacare, the site visit was an opportunity to hear from various health officials, practitioners, advocates, and patients on how access to care locations like Loyola's has been extremely beneficial to those it serves.
Access to care has been around for almost 29 years, about 29 years. It was started in 1988 in response to a request for proposals from the Chicago Community Trust.
Your office, your staff have went above and beyond to connect with Arab American doctors to serve our clients. And when we talk about inclusivity, you really have served our families and community members, and I really appreciate everything that Access to Care has done.
With the Affordable Care Act enrollment and changes that transpired during the time that I've been there, I think that the main point that I want to tell you is that there is still a need for this particular program. I still have residents to come in and that need access to the program that don't have access any other way.
In my mind, one of the things that Access does that is absolutely invaluable is it provides a balancing cost so that a lot of other people don't end up spending that much more money, which is a ridiculous expenditure of time and resources. It provides correct resources, correct monies, and it's directed. A program like this, if not existing, or if even lessened, especially with the increase that I have seen, is only going to work in the negative for entire communities.
Every time that I talk about access to care, I get excited because I know how important it is for our community to have a program like this one. And I know for our Latino community, which we rarely see a doctor, we trust in other options before going to a doctor. Now I see the increment of Latinos trying to get this service.
I'm impressed with the good work that you do, and needless to say, we will continue to support that good work. I'm troubled by what may happen in Washington, and that we will, needless to say, stay in touch with all of our friends and allies as we learn more about what's coming. Let me just say, we have in our own Medicaid managed care program, which is part of the Affordable Care Act, we have 140,000 individuals. And these are people who haven't had insurance before, or have only had it sporadically as their employer provided to them through work. So the Affordable Care Act has been a godsend to lots of folks. Clearly many of the people you serve are not eligible for Affordable Care Act services, but it's been a godsend to many people, and it's unclear what its fate's going to be. And that, needless to say, will impact the county tremendously, as well as those individuals who are in the program. But we're all going to be in trouble if the federal government decides to withdraw the support from Americans who need it so much. So.
Every person in Cook County who needs health care has health care. That's been what the Cook County Health and Hospital System has been about since it started. And know that we want to work with you as a partner. But we also need all of you to keep giving us feedback on what's going on out there, because it's going to help. Facts are the only way we're going to win this battle with the new administration.
All of you need to reinforce with your congresspeople that this is something that's really critical to your communities and to the people that you serve, because we're in the fight of our lives here. It's one thing for them to say that they can make the Affordable Care Act better, and it's another thing just to eliminate it. Right. And so far what they've said is we're eliminating it.
By having visits like this one that promote healthy dialogue among all concerned, Cook County remains at the forefront in addressing the issues and needs of county residents as a whole.
We were out here today, President Preckwinkle and myself, to talk to the people from Access to Care to find out how the $1.5 million that the county has been providing to them is being used, and how we are servicing people who fall through the cracks, even with the ACA. And more importantly, as the threats to the ACA now are developing, how we will ensure that those uninsurable people get quality care and that they and their families become important members of our community.
I'm very grateful for the opportunity to visit Loyola and this clinic and to hear about the good work of Access to Care. They are a godsend to us in Cook County and serve many of the good people who are ineligible for federal programs like Medicare or Medicaid, and who of course nonetheless need quality care. So I'm very grateful to Access to Care for the good work that they do, and we wanted to come today to hear a little more about it.
This has been a look inside Cook County.